Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. This is going to be a very, very important show to literally thousands upon thousands of people who are listening from around the world. We're now heard in over 30 countries, and you're going to, and this show today is on C. difficile infection, C. diff, as it's commonly called. Um, Wait till we get to it. Get pen and paper ready to write. It's going to be very important. Um, you'll see why. The show is about, yes, there is a cure for C. diff, C. difficile infection, Clostridium difficile, Clostridioides difficile, all the AKAs, all the same thing. It's going to be very important to listen to the show and write things down because the first is our sponsor, PromoLife. If you can afford to do it, will become a very important part of a home care self-treatment to get rid of this. They make home care ozone generators. You want to get set up, as you're going to learn how to get set up for them. It's very important. It can add on to everything, as you're going to learn about how intravenous ozone can be important. But we have a way of perhaps getting you well without having to even do ozone or any other kind of medicine. And everything we're going to tell you today is going to be compatible with pharmaceuticals. So if you're already taking antibiotics, unfortunately, whether they're working or not, obviously you may be listening to this even if they are helping. We're talking about how to get rid of C. diff permanently, completely, hopefully once and for all, provided you don't get reinfected. All right. Having said that, so you're going to want to contact PromoLife if you can, when you hear all about the details later on getting set up for home care. And you tell them you heard about it here on the show, Dr. Robbins Show, and they'll do something very special for you financially. So you'll be very happy as a gift. You call them at 888 742 3404, 888 742 3404, and tell them you want to get set up for home care. And you're going to learn some more details about it because that's part of this show. In addition, I want to thank my other sponsor, as you can see behind me, if those of you are videoing this when we post these things, these shows in the future, Doctor's Biome. Doctor's Biome is essential for this, as you're going to understand why. And we're all going to be offering a free open clinical trial. Now, that's provided you're listening to the show now and within so many possible months from now, because they can close the clinical trial, the free open clinical trial, at any time. So if you're listening to this show a year from now or 2 years from now, you'll still be able to get help, but you won't be getting it for free. The key is to take action, not to sit back and listen and think and try to figure. You're just going to continue suffering for that during that time. The key is to take action and trust that I'm not here to sell you a bill of goods, but to sell you a way to get well. That's what our show is dedicated to. Having said all that, Doctor's Biome, available at doctorsbiome.com. That's doctorsbiome.com. Sounds like BioMe, but it's Doctor's Biome, as you could, .com. It's a very special probiotic beverage, and because I'm going to spend time talking about its importance in the show, I'm not going to mention anything more about it here. But when you get on, you're going to want to get involved in the free open clinical trial. Otherwise, everybody else can get on and buy this product, as you're going to learn why it's so important as a probiotic beverage like no other ever. All right. And you would use the code radio20 to get a very big discount, the code radio20 off your first order. And then for future orders, you can continue to get a discount if you go on auto ship, which you can cancel at any time. It comes with 100% money back guarantee, so you can't lose. In fact, it's better than 100% money back. How could that be? Well, if you don't like it, you can't take it for some reason, they'll tell you to give it to somebody else. You don't have to send it back. And they'll still give you your money back. 100% refund. And for most of the US right now, it's still free shipping. Okay, it's still free shipping. So go to doctorsbiome.com, use the code radio20, and for future orders, go on auto ship. All right, this is very important to everybody, including the C. diff patients that are going to be listening to this, or their family and friends. All right, let's get right into the show. So we're going to first, what the heck is C. diff? Okay, that's the first thing, is to talk about what it is. And I'm not going to go into a heavy duty talk about it, because most of the people listening to the show already know what it is. But if you don't, and you find this interesting, so C. diff, its nickname, also known as C. difficile, or Clostridium or Clostridioides difficile, is a bacterial infection. It's horrible. There's many different ways of getting it. We're going to talk about that. It can easily spread from person to person. It's a major health threat. If you go into a hospital and go into the ER or go into a lobby in the hospital where there may be doctors and healthcare workers walking around, and just yell out loudly, C. diff, or even quietly say it when you're in a crowd there, heads are going to turn. You'll know who's a healthcare practitioner. All the heads are going to turn and look at you. It's like, what? It's that serious a health threat. There's 500,000 cases of it every year just in the USA alone. Hundreds of thousands of cases worldwide. It'll get close to, or in and around, as an average of 300,000 hospitalizations every year. That's why it's so important in hospitals. It takes a financial toll on healthcare. Several $billion a year, 4, 5 or more $billion a year are spent in trying to help treat it and get rid of it. In this country, 28 to 30,000 people a year will die from it every year. Right, COVID is over, but C. diff isn't. And people are going to die from C. diff every year. In 10 years, over 300,000 people will die. Well, what's 28,000 or 300,000 people? The number isn't very much when you compare it to all the people that live here in the US, even though huge numbers may be dying around the world also. What difference does it make? It doesn't, unless it's somebody you know and love. Or worse, you. I don't know if it's worse. I think having somebody who you really care about pass away from it is even worse than if it were you. I know I would give my life up for my children and grandchildren and my wife. And sometimes that opportunity is not in our hands, and God takes somebody close to us. It's a very sad thing. I've been dealing with this now for many years, losing close friends and family. So what happens? How do you get it? Well, you may be just taking an antibiotic for an infection of some kind. Antibiotics tend to kill all the good bacteria in your gut, as well as all the bad bacteria in your gut, as much as the infection that you might have elsewhere in your body. And we have a healthcare crisis with antibiotics because bacteria have been developing resistant strains over the past decades. And with these resistant strains, they've had to come up with new generations of antibiotics, more powerful ones. And what happens with them is they come with a host of adverse effects, a large number of harmful side effects. And one of them is, by killing off all the bacteria, good and bad, in your gut, the ones that the one that can't easily be killed except by very specific antibiotics that are very risky and dangerous to use. These antibiotics generally are only used for C. diff and other very serious infections. Well, by killing off everything else that keeps this infection, which is in everybody, it's all over the world, in check, now it has nothing to stop it from growing. And when it grows, it starts to cause all its digestive problems, including uncontrolled diarrhea. And the symptoms of it are just horrible. Bloating, diarrhea. You might get constipated even for a while, but eventually it's going to be uncontrolled diarrhea. You can get severe cramping, abdominal pain, even without the cramping. Patients with this suffer from severe fatigue, nausea. How do you eat when you feel nauseous all the time? So you're going to lose weight. And this is not a great way to diet. Trust me on this one. This is not the way to go. You can get rapid heartbeats, a swollen abdomen, get blood or pus in your stool, horrible smelly stool. That's pretty much it. But when you get these and nothing will alleviate it, oh my God, how terrible. You have no idea how bad it can be. God forbid you ever get this or have this right now. Well, then you certainly do know how bad it can be. Fortunately, we have the answer. So stay listening. Now, another way to get it is because of contamination. You touch a surface where the C. diff has been transferred. And we're going to talk all about that because that's all part of prevention. Okay, so it's very important to prevent getting the infection and be careful. And that's just key. You're going to learn about how easy it is to get it in a hospital. So you can get it just from having been in a hospital for some other reason, even just visiting someone in a hospital, and you can pick up C. diff. So transfer, contamination, touching contaminated surfaces. Back to antibiotics for a second. I think that's important. If you eat red meat, chicken, farm-raised fish, unless it's organic, hopefully kosher or halal, you're going to get uncooked out doses of antibiotics. I don't care if you burn the meat. These antibiotics that you may find in the food slowly but surely could kill off all the good boys as well as all the bad boys that may be keeping C. diff in your gut in check. And now C. diff and candida have a chance to overgrow. You may be thinking, well, I do things to suppress it. I do things to take it. Doesn't work. I wish it did, but it doesn't. Let's start talking about how to prevent it. I know most of you probably are listening to this to know how you can get rid of it, and we're going to spend a lot of time on getting rid of it. But I want to just give you some ways to prevent it, because if you get rid of it once, you don't want to get it back again, do you? That's not a small thing. The number one way to prevent getting it from contamination is by washing your hands in the bathroom. Now, I'm going to go into some stuff very quickly that may sound a little bit gross to you, but if you have this infection, you have to consider that you should go into the toilet. Take my advice on this. Don't keep them in there. Put on a pair of latex or disposable gloves, okay, of disposable gloves of some kind. When you go in, now your hands are protected, and what you're touching is with everything is with the disposable glove. When you sit down and you wipe yourself, understand that the toilet paper may be contaminated, and you'll understand why just from the touch. Secondly, when you flush, you have to make sure the seat cover is down. Now, a plume comes out every time we flush our toilet, and this plume will hit the back of the seat. So every day you should wipe down the back of the seat. I like to use peroxide, not alcohol. You can use other cleaning agents like you might have used for anything else. But I like peroxide. It's cheap, it's easy, it's fast. Wipe it down. Wipe the seat down every day. When you're ready to take off the gloves, pull them and turn them inside out. Throw them away. Okay. Now your hands are clean, so you can actually pull up your pants and adjust yourself. Why don't you want to do it with the gloves on? Obviously, your hair, they may be contaminated. Now you're touching your clothes, and your clothes can be contaminated. If someone in the house has C. diff, their clothes should be washed separately. And very carefully handled with disposable gloves when you put everything into the wash. You should store their clothes separately as well. Washing your hands with lots of hot water and soap is very, very important in terms of preventing. When you wipe your hands in a bathroom, paper towels are probably the better way to go, because you don't want to be using the same towels that everybody else has been using. Avoid eating foods when it's meat, chicken, or farm-raised fish. Avoid eating foods that might contain antibiotics. Stick to organic, kosher, or halal. If you're eating meats, I don't, but if you do, that's the way to go. If a fish, wild-caught fish, stay away from farm-raised, go for wild-caught fish. We're going to go to our first commercial break. And when we come back, we're going to get into how to get rid of it. We'll be right back.
Okay, nicely done. We are clear. Back in about 2 minutes.
So everybody, I'm going to be talking now because I hope that this is going to be posted up on a new YouTube channel that I'm going to be doing. So you'll get to see me and my mini studio, as I call it. And you'll be able to see me and hear this show on YouTube. Very important. I'm finally getting into something that at my age, social media, I'm not very good about it, but I have patients who insist I need to, and we're going to start doing more and more social media. So on YouTube, there won't be any dead time, because right now you are not hearing the commercials that are airing here on Voice America. But on YouTube, it'll just be talk with me. So that's what's happening. It's going to be important to get a pen and paper if you didn't already do it from this point on. There's a lot of stuff I'm going to tell you that you can do to help prevent as well as to treat it. And the prevention portion is to not get reinfected. Oh my God, once you get rid of this, that's how important is that? It's also important, if you live with other people, that they don't become infected. So that's why this part, the next segments of the show are going to be so important. We're going to go into the nutritional things that can be done. I already gave you some of the physical things, foods you can eat, hopefully, if you're able to eat anything at all. Certainly in terms of preventing it, reoccurrence, the foods would be very important. And then something that you're going to be very excited about.
All right, Dr. Robbins, stay by, coming back.
Okay, we'll be coming right back now in just a few seconds.
You are tuned in to Functional Medicine with Dr. Robbins. If you have a question or a comment about the show, please call in to 1-866-472-5792. That's 1-866-472-5792. You may also send an email to ozonedoctor@yahoo.com. Now, back to Functional Medicine with Dr. Robbins.
Now there's something also in the physical things that you should do to help prevent it and or transfer it or pick it up, is that people, I mean just about everybody, including myself, touch their face up to 50 or more times per hour. Your hands, if they're not clean and contaminated with this bacteria, can transfer this bacteria to your face, and it doesn't take anything then for them to grow and eventually reach your mouth, and in essence, you've just swallowed it. It's my opinion, and the gastroenterologist specialists may disagree with me, that that is one of the ways that it's transferred into the human body. Because it's so difficult to kill, we can't count on our saliva or the stomach acids and bile salts and digestive enzymes to destroy the bacteria. Because it's so hard to kill, it may actually survive. Now that goes into food preparation. If you're going to be the food preparer at home for someone with C. diff, or even without it, you have to make sure you wash your hands with soap and water before you do things. And if you're touching surfaces, frequently wash your hands with soap and water. Lots of hot water and soap, best way to get rid of and not transfer this problem. Now, there are foods that can help in the elimination of it. Most of the people who have C. diff are taking antibiotics for it. There's two basic ones given, and they're taking antibiotics for it. Everything I'm going to tell you is completely compatible, synergistic. That means it works with any antibiotic that you are being given, any pharmaceutical that you are currently taking. So it's not do this and don't do this if you're doing pharmaceuticals. You can do it with pharmaceuticals if you have to. And when you're dealing with this life-taking disease, this horrible, painful disease, that makes it very important. So I already told you about some of the foods to avoid and what foods to eat, but garlic, and you want to do as much, even though people may not be able to come near you, as much raw garlic as possible. Raw garlic contains a chemical, a natural sulfur-containing compound called allicin. And it's the allicin that's known to destroy this horrible bacteria, that can contribute into the destruction of this bacteria. You want to do everything that can boost your immune system. So berries, for example. Now, again, we're only talking organic, because when you have problems like this, you don't want to be eating food that isn't organic. Hopefully, organic food doesn't contain pesticides or herbicides that are just going to make it even harder for your body. So you want to make sure you're using organic foods only. Organic berries, by the way, unless they're organic, absorb humongous amounts of pesticides and herbicides. They're probably one of the most dangerous foods you can eat unless they're organic. And that 180-degree reversal become one of the healthiest foods you can eat. And I don't have an organic berry farm. but I do grow berries here at my house, organic raspberries and organic blackberries. I have 2 berry bushes and white mulberries. And um, I also have, well, let's move on. I also have other berry trees too, berry bushes, I guess they call them. So you want to do lots of servings of them every day. Avocados, very healthy. Organic grapes, very healthy. Mushrooms, shiitake, maitake, reishi, very healthy for this. And you can use the raw mushroom, organic, of course, if you can find them. You can find them very often less expensively in Asian markets. So look around for Asian markets rather than going into the expensive or organic food markets, supermarkets. You may find it much less costly to get some of these mushrooms in Asian markets if they're available to you. The dried versions of these that come in capsules or powders have some benefit as well, but way more costly than if you did it the other way. Vitamin D3, very, very important in supporting colon health. You want to take several thousand units of it a day in divided doses. You don't want to mega dose anything. And of course, you need vitamin K2, quinone 7 to help in the absorption. Okay. You always should take K2 with D3. Vitamin A, very important nutritional support here. Anywhere between 3,000 and 10,000, 3,000 micrograms, which is about 10,000 international units. You can't really overdose on vitamin D3, but you can overdose on vitamin A. So be careful with that. Vitamin E can be very important. The omega-3, 5, and 7 fatty acids. Avoid fish oil sources. Fresh fish, okay. Organic fish, okay. But avoid fish oil as a source for your vitamin E, your omega-3, 5, and 7 fatty acids. Read my buddy Dr. Rowan's book on it and why. You want to avoid foods that cause inflammation, particularly to your gut, which is already inflamed, like rice and dairy. We've done shows on why you shouldn't be eating GMO food, so don't eat GMO food. Processed foods and meats and grains, white bread, white rice, pasta, breakfast cereals. Avoid all these things. Avoid snack foods, foods that contain sugar. Fried foods. These are the foods you need to, and any food that, of course, has artificial trans fats. Okay. These are the important things to avoid. Now, let's talk about how to fix it. For those of you that can, contact PromoLife at promolife.com. Call them at 888-742-3404. 888-742-3404. And you tell them, you heard about it here on the show, and you want to get set up for home care ozone. In this case, home care ozone therapy is going to be rectal insufflation. This way, rectal insufflation is an ozone enema. Listen to my shows on ozone home care. They also have videos and will help in the support on how to do rectal insufflation, an ozone enema. It's simple, it's easy. You wet your colon first with a fleet enema or a bulb syringe so you can absorb more. And then, of course, so it cleans it out. And then you do rectal insufflation. I'm recommending rectal insufflation at a 20 microgram concentration to start with. You can start with 250 cc's of oxygen and ozone gas in the bag, and then build up to a full bag of 750 to, depending on the bag you're using, 750 or 1,000 cc's of gas. You can do this morning and evening. You squeeze it in, hold it tight as you can to keep the gas in, and then relax, squeeze more gas in. Listen to my shows that we've talked about this. There's more details about it that I'd like you to know. And unfortunately, not enough show to go into rectal insufflation in great detail. You can do it on your back with a bunch of pillows under your butt. I don't particularly like it standing up, bending over. You're already in pain and uncomfortable. You can do it laying on your right side, not left side, right side. Make sure you're using vegetable oil to coat the little plastic catheter that you're going to stick inside, that's about as thin or thinner than a rectal thermometer. And that's how you squeeze the gas in there slowly. That can be very, very beneficial. For those of you that can't afford it, you can try getting their organic ozonated hemp oil suppositories, organic ozonated hemp oil suppositories. And you can insert a suppository every evening. You might want to put some paper towels or napkins outside you there in case some stuff leaks out, and go to sleep so you don't, in your underpants, whatever, so you don't damage, grease up your bed or with anything that's coming out of you there. And unfortunately, the suppositories can't get all the way back into the colon, where the gas can get somewhat of the way back. But some of the gas can get absorbed into the blood and thus attack the problem from the inside out. That's where intravenous ozone therapy comes in. Here, I'm willing to say that any form of intravenous ozone therapy will be beneficial, but the more powerful forms of intravenous ozone therapy are the ones you're going to need to really fight this. Now, it has to be available where you live. Okay, it has to be affordable where you live. Most of the doctors out there, many of the doctors that I've trained, are charging fees that only the wealthy and financial elite can afford. Our clinic works in a unique way. I'm 76. Thank God I don't have to send my kids to college anymore. I don't live in a 30,000 square foot residence, 6,000, 8,000 square foot residence on a 5-acre property. So we charge fees that people can afford. My office number is 212-581-0101. If you need to speak to me, call my office and they'll tell you how you can get in touch with me personally. Yes, I actually speak to people. Okay, 212-581-0101. Now, in the office, we do intravenous ozone therapy, but Arnold Schwarzenegger intravenous ozone therapy, not the wussy girly boy ozone therapy that's being more commonly used around the US as well as the world. Though the number one method around much of the world, not in Europe, both Eastern and Western Europe like to use wussy girly boy ozone therapy, and not here in the US, though I've trained many doctors that do direct IV ozone. This is where we push the oxygen and ozone gas directly into your veins. I've done shows on this. Listen to my show called Intravenous Ozone, Everything You Need to Know. Everybody can get DIV, and particularly Robbins' method DIV, my protocols, to get rid of this infection, because we're attacking it from the inside out. We're attacking it from the inside out. It's not a fast fix, but you may start feeling much better very rapidly. That's one of the beautiful things about the direct IV. And we are allowed and able to use little itty bitty veins using little itty bitty needles. So everybody can virtually get it, and we can use PICC lines. So we make it so that virtually everyone can get it. Whereas the blood methods of ozone, the hyperbaric high dose ozone, even with the ultraviolet blood irradiation, hemolumin that we use, you need big, strong veins for that, and it can't be done every day. We have to use heparin, which is a blood thinner. People are already suffering. They may have had IV antibiotics in the hospital. Their veins may be shot. At this point, the good news is we can do direct IV with what they call baby scalp vein sacs, very, very small, fine needles, even finer than most acupuncture needles. So everybody can get this therapy that can afford it. And if you're suffering enough, it pays to come to New York to visit us and get the care. 212-581-0101. I've done it, the direct IV method, over 365,000 treatments in the last 29 of my 34 years doing intravenous ozone, out of my 50 years as a doctor. This is what we specialize in. And we're able to help people unbelievably get rid of this horrible infection and thus save your life. Stay with us because we're going to go to our commercial break now. And when we come back, I'm going to tell how everybody listening to this show may be able to get rid of this in a very easy and not just inexpensive, but free way. So that can't get more inexpensive than that, in a free way. We're going to be talking about our free open clinical trial of Doctor's Biome. Wait till you hear what has happened with this free open clinical trial. Okay. How people have already benefited from it. You won't be sorry if you get involved in this free open clinical trial. I can promise you that. It may be the final answer for you after months, if not weeks, months, certainly some people even years, okay, years of suffering from this before they pass away, or having it come back again and again and again and again. Okay. 1 in 6 people who get C. diff infection will get it again within the next 2 to 8 weeks after they believe they got rid of it. I don't know that they even really got rid of it, but there is a way to tell. So now I'm going to tell you about a free open clinical trial for Doctor's Biome medical food. Doctor's Biome gut health medical food. They have several different products. I am published in the Journal of Gastroenterology Research showing how Doctor's Biome can completely suppress Clostridium difficile, C. diff, in vitro. That means in the laboratory. When I say completely suppress, I mean 100% suppression. It stops it from growing. Doctor's Biome is a very special probiotic drink. It contains 15 patented strains of bacteria. But this is important. They're next generation bacteria. Next generation bacteria mean that these patented strains have been created to survive the stomach acids and bile salts over 90%. Whereas capsule, powder, and tablet probiotics are virtually destroyed over 90% in your stomach. The next is they have to transition from your stomach through your small intestine to your gut. Then they have to stick to the wall of the gut where C. diff exists, and yeast is overgrowing now because of antibiotics, which can lead to many of the symptoms of C. diff. Well, we have shown, and we are published on this, showing complete suppression of Candida in vitro. Now, that doesn't mean you're going to get rid of all your yeast. It's going to get it back in balance again. No one ever gets rid of yeast completely. And I also want to be clear, there's no such thing as 100%. Nobody, including me, is giving you a 100% guarantee that all the things I'm telling you here will get rid of C. diff. I am telling you this may be the only thing that can get rid of it safely, permanently, completely, once and for all. 1 in 6 people who get it is going to get a recurrence in it. Actually, it's even higher than that. Okay, even higher than that. But bottom of it all is you want to get involved in this free, open clinical trial. What you will do is go to doctorsbiome.com. They're putting up a new website. Okay, so when that goes up, I don't know where you'll see it or whatever, but you can go to doctorsbiome.com and you should have a link there to help you sign in for the free open clinical trial. Otherwise, call customer service and they will help you get hold of that link so that you can get involved in it. Yes, you have to have a computer because there's weekly forms to fill out. This study is linked to an IRB. Your doctor will know about this because all your doctor information who's treating you for C. diff will be communicated. All the results that are happening with you will be communicated to your doctor. So your doctor is involved in that part only. And all it is a probiotic beverage. But because the 15 patented strains are what's also called smart probiotics. They didn't go to Harvard or Yale. A smart probiotic has actually been created to stick to the wall of your gut. So you have a combination of 15 patented strains in the hundreds of billions of colony-forming units, CFUs, and it's that will now survive the stomach and stick to the wall of the gut, and it's all in an absolutely delicious 100% organic mint, kale, lettuce, cucumber, celery, apple, lemon juice. There is no alcohol because there is no fermentation. There is virtually no sugar. It starts with, I think, about 4 grams of naturally occurring sugars, which I guess then are organic, from the vegetables and fruit. But that is part of the food that these bacteria are eating because it contains some of the pulp. You won't see it. They have it so that it's so finely microsized that it's suspended, so you don't actually even have to shake the bottle in the juice itself. And that is the food, the prebiotic, that the probiotic biome is eating. Now, I lecture on this around the world. On probiotics and microbiome. You can listen to some of my other shows on it. But we have had nothing but amazing results here. Let me read you this. See it, where do I have it now? Okay, David P. 9 months ago, I was diagnosed with Crohn's disease and tested positive for C. diff. Prior to that, I experienced the most horrific gut pain or any pain I have ever experienced. Could not eat any food as any intake would increase the pain. As a result, I lost over 50 pounds in 7 months and mostly muscle and became very weak. My functional doctor put me on a 90-day program of various supplements. One of those products was Doctor's Biome Medical Food. He's part of this clinical trial. I am so excited to report that after 2 GI tests, the C. diff is gone. But more important to me is no pain. And I now can consume food and have added 8 pounds to my weight. I am still taking the medical food only because the C. diff has known to make a return. I believe Doctor's Biome Medical Food saved my sanity. I will definitely recommend anyone with C. diff to give this a try. It's free. It's an open clinical trial right now. You don't have to pay for it. Medical foods are not cheap. By definition, they're not cheap. So you want to get involved as soon as you can by contacting doctorsbiome.com, doctorsbiome.com. It's important to know that after you come off it, you'll be given a free month supply of Doctor's Biome food supplement version, Doctor's Biome Gut Health in the food supplement. That's what you're going to stay on. You don't need to stay on the medical food version. You can go on the food supplement version just for general health. And that's where you'll be able to use the code radio20 and go on auto ship and everything to save money. It's not a cheap product. Nothing good is cheap and nothing cheap is good. Listen to Rona R. Rona R. I have been using Doctor's Biome since 2021. In August of 2022, I was prescribed antibiotics for dental surgery. The dental surgery spanned from August to October 22. And I remained on antibiotics 7 to 10 day intervals for that period of time. During that time frame, the use of antibiotics, I ran out of Doctor's Biome. So from October 19th to the month of November of 2022, I was not using Doctor's Biome, that's the food supplement, Gut Health, daily for 51 days. Critical error on me. On October 24th, I developed severe diarrhea, abdominal pain, extreme bloating, and fatigue. I felt sick, so I went to my primary care doctor. She asked if I had taken antibiotics recently. I had, of course, so she sent me to do a lab test for C. diff. She prescribed yet another antibiotic. I did not take it. I ordered Doctor's Biome and received the shipment in 2 days. I began taking 2 times daily. That's because she was using the food supplement. Abdominal bloating and pain much better after 72 hours. Normal bowel movements, pain, and bloating gone. I emailed my doctor and asked if I still needed the antibiotics. She said only if the diarrhea returns. Diarrhea did not return. It is July of 2023. I take Doctor's Biome daily. I have no diarrhea, no bloating, and no pain. She has no C. diff. How do we know? And I just gave you David and Rona, but Rona was just Doctor's Biome, but David with the medical food version, which is part of the free open clinical trial. There's been a dozen people on it already in the free open clinical trial with the same results. This will be writing up as a paper and getting published when the clinical trial is over. How do you know it's gone? You have to do a feces examination, and they look for toxin A and B in your feces. If no C. diff is detectable in your feces and toxin A and B are gone, then we believe that the infection is completely gone from your body. That's how they're going to know that it worked. And if that is gone, of course, you can repeat the test sometimes later. Okay, you're going to have to repeat the test sometimes later. A couple of weeks later, just to make sure, because you want to make sure you don't have a false negative or a recurrence. Now, all you're going to have to do in the clinical trial is to give your information, your doctor's information, so he or she can be reached, and you're going to have to fill out a weekly questionnaire. It's real simple, okay? Using a thing called the Bristol stool chart, and they'll give you how what it is. You'll say what your feces looks like, and then you're going to answer the question: do you currently have diarrhea? Are you still having bloating? Do you have abdominal pain? Do you have cramping? Do you suffer from fatigue? Have you gotten a fever? Do you suffer from nausea, from dehydration? Have your rapid bowel movements decreased and in number? Do you have a swollen abdomen? Do you have blood or pus in your stool? Has your loss of appetite, if you had it, returning? Okay. So you're just going to have to be answering these simple questions each week to be part of this free open clinical trial. Big deal. What if you can get rid of this and it won't cost you anything? Okay, it won't cost you anything. So I want you to go to doctorsbiome.com. That's doctorsbiome.com, doctorsbiome.com, and look for where you can sign into the open clinical trial. If you're having a problem with this, feel free to call customer service with Doctors Biome. It'll be on their website, and they'll help you to get involved in this. You will have to be able to fill out this questionnaire. That's very important to get involved in on a weekly basis. That's the sole amount of work that you have to do besides drinking one of these delicious 2-ounce shots every day. That's all it takes. I can't imagine why anybody would be hesitant to do this. Unfortunately, people are so fearful. They're worried that anything they do may make it worse. It won't. At worst, it won't make it better. We take Dr. Do No Harm very seriously here. It's either going to work or it won't. At worst, even than that, maybe it'll just improve your problem. Maybe it'll reduce some of the suffering, even if it doesn't get rid of it. The key is you're going to be telling them the truth. That's all that they want when you answer their questionnaire is tell them the truth. What has happened to you? And then, of course, they're going to ask you, like David did and Rona did, to post a testimonial, a review, an honest, true review on what happened to you, so that they can use it to help other people, because people have to hear that other people are getting well from something to even want to try something for free. And I don't blame you for being fearful. I know how you've been suffering. You have to trust me that we're only looking to help you here. So please consider getting involved. doctorsbiome.com. Also, contact me in my office at 212-581-0101. 212-581-0101. Or email me at Ozone Doctor, OZONEDOCTOR, all spelled out, Ozone Doctor at yahoo.com, YAHOO, Ozone Doctor at yahoo.com. Everybody stay safe, stay healthy, and stay well.